I would imagine you get closer to these patients
Absolutely.
than a family doctor does with,
Yes, I
right?
think I know where
How
you're
does
going.
that?
That's actually, it's a really astute point, because in therapy, we call these feelings that develop between the therapist and the patient transference, which is how the patient
Okay.
feels towards you, and countertransference, which is how you feel towards the patient. And what
Interesting.
we find in psychedelic therapy is both of those processes are intensified because it's so intimate.
Yeah.
And a lot of
That's a good way
trust
to
is
put it.
built up. And so the safety is really important. And one of the things that's really important is, how does the therapist care for themselves?
Yes.
Because it can actually, the intensity of the psychedelics can actually like put you in a bit of a non-ordinary state yourself when you're sitting there, even without taking any medicine.
Right.
Just like the energy in the room can be actually
Sure.
quite powerful. So it can bring up your own shadow aspect, stuff that's unresolved in you. For our group, if we're working at the end of life, like, you really have to work through your own relationship with death as much as you can, so that you can hold the space cleanly without your own stuff kind of infiltrating. And so, yeah, I think intense intimacy is formed, and that's something that I think the field is still grappling with, is like, especially in the clinical trials, like, how do we use the term terminate someone from a clinical trial, which is a terrible term, but like, how do we, when people have connected to us so deeply, and that's this very special kind of bubble, and then the 2-month trial is over, and how do we make sure that they're getting the support that they need